Now, the Young Nurses Indaba trade union says it's receiving worrying reports about the impact of floods in KwaZulu-Natal on the quality of patient care in hospitals. The union says it knows that no less than 58 healthcare facilities have been damaged by the disaster. To discuss, we're joined by the president of the Young Nurses Indaba Union, Sicina. Thank you for being with us, Mr. Sicina. How many healthcare workers in KwaZulu-Natal, firstly, are your members, and what are they saying about the situation in hospitals and clinics?
Thank you for having us. Thank you. Good evening to your team, yourself, and your viewers as well. We would like first, as Young Nurses in our trade union, to send our sincere and heartfelt condolences to everyone who was affected, who has lost their loved ones. God will watch over them. I'm in KZN as we speak. I'm in KZN. I visited today two facilities. It was Inanda Community Health Care Center and also Mahatma Gandhi Memorial Hospital. The situation is dire. We have members in all these facilities. The situation is dire on the ground. At Inanda Community Health Care Center, it's not functioning. It was shut down today because there's no water. Pipes were washed away by these floods, even though they were facing the issue of water even before this pandemic. But it exacerbated the situation. As a result, patients were turned away. I went from there, I went to Mahatma Gandhi Hospital. It's the same situation as well. Their casualty is a complete mess because remember, nurses and the healthcare workers in particular can't go. Those who are from areas that are affected by these floods can't go to work. And this happens while we are in the midst of obviously gross shortage of staff that Young Nurses Indaba trade union is always making noise about. But at Prince Mshieni, even nurses were actually scared. Those who were there, a healthcare professional saying that the building is cracking and it looks like it's going to sink. When we observe on the ground, there's no quality nursing care that is going to be delivered now until we rise above this pandemic.
Yeah. So where the walls seem to be cracking, I mean, are the nurses still staying there? Are they having to try and care for patients in that sort of circumstance? And sometimes you said patients are being turned away. That is very sad. But in some instances, are they having to care for patients when there's no water in the facility at all?
It's a very complicated situation. Remember, we always say nurses, we develop an emotional attachment to our patients. Our profession is that it's a caring profession. We actually care about our patients. Now, nurses were actually caught in between the hard place and the rock. They don't know because their knowledge is that obviously if there's no water, there's gonna be outbreak of many infections, like there's gonna be diarrhea, salmonellas. You don't actually know what else is going to happen. But now, what do you do as a healthcare professional, as a nurse in particular? Do you leave that patient in that particular situation? No. Other nurses went out as far as actually making sure they collect water. They took buckets, put them on top of their heads, to go wherever they can actually get some form of water. Others were actually buying it. They were buying it. I saw healthcare professionals, nurses and doctors like carrying water to say patients need to get medication. They also need to bath. It's a dire situation, more especially because you are a nurse and you are from the Inanda community. Here in Durban, it's not that where you are staying there is water or the situation is okay.
And we know even traveling to work is a difficult situation as well. Very quickly, we're running out of time. You've criticized government for austerity, so not spending more on hospitals and clinics. What was the situation before the flooding in KwaZulu-Natal, which would obviously have gotten worse now?
Even before COVID-19, Young Nurses Indaba Union we've been mentioning it and making noise about the fact that our healthcare system is falling apart. Our healthcare system is falling apart, particularly because those in positions of authority don't care. They don't care about public healthcare system in particular because they are not the beneficiaries of this system. So that is why they are neglecting it. Even before COVID-19, it was under attack. Then COVID-19 happened, it exposed us. We were crying about gross shortage of staff and all that stuff. Now, this pandemic here in KZN, Durban in particular, it's that the situation is worse. There are clinics. I was so shocked when one of the nursing service managers telling me at Inanda clinic to say, do you know there are nurses from other clinics who have been sent to come and work here because their clinics were actually destroyed completely? So, like, we are asking yourself, patients are now redirected to those particular facilities that look like they were not that much affected. But the issue of water is actually hitting us. That situation is bad. I don't want to lie.
All right, sure. Thank you very much. The president of the Young Nurses Trade Union, Sicina.